Rising drug prices continue to dominate healthcare news. CMS expands value-based insurance design in Medicare, and a blood test could offer an early warning for Alzheimer's disease. Welcome to This Week in Managed Care. I'm Laura Jost. After nearly 30 drug makers announced price hikes in January, a study in Health Affairs found most cost growth in the United States comes not from new blockbusters, but from increases for older drugs. Now, the Institute for Clinical and Economic Review, known as ICER, will track those increases and report on those that can't be supported, said ICER Chief Medical Officer Dr. David Rind. By identifying drugs with substantial price increases, despite no new evidence of added benefit, we hope to make an important first step in providing policymakers with information they can use to advance the public debate on drug price increases. A draft protocol is available for comment. The first report is due October 8th. For more, visit ajmc.com. Drug shortages and Medicare reimbursements that don't keep pace with drug costs are forcing some hospitals to cut staff, putting patient safety at risk. That was the message from a report by 3 major healthcare groups, which found that drug spending rose more than 20% over a 2-year period from 2015 to 2017. Interviews with key hospital leaders found they questioned the price hikes relative to the value of the drugs. Outside the hospital, a research group found that insulin costs for people with type 1 diabetes doubled between 2012 and 2016. The Healthcare Cost Institute analyzed 15,000 claims from large insurers and found the following. Over the 4-year period, gross spending on insulin per person increased by $2,841, and spending on insulin accounted for 47% of the $6,027 increase in overall healthcare spending per person during the period. CMS this week expanded its value-based insurance design model in Medicare Advantage and created more risk sharing in Medicare Part D. VBID interventions encourage low or no cost coverage for prescriptions or healthcare procedures that will prevent higher healthcare costs elsewhere. Both plans are voluntary and expand a pilot that began in 2017 to all 50 states. VBID interventions can cover one or more areas. VBID by condition, socioeconomic status, or both, including social determinants of health. Programs for Medicare Advantage and Part D rewards and incentives, increasing access to telehealth, and more coordination of wellness and healthcare planning. CMS estimates the voluntary models will save $2 billion a year. For more, visit ajmc.com. Researchers have used a blood test to detect biomarkers for Alzheimer's disease. The findings, published in Nature Medicine, predicted differences about 16 years before patients with a genetic mutation would be expected to show symptoms. While the test is years away from being used in clinical practice, the hope is that it could help identify brain disease, not only for Alzheimer, but for other neurodegenerative conditions such as multiple sclerosis or stroke. The test detects a structural protein that forms part of the internal skeleton of neurons. When brain neurons are damaged, the protein leaks into the bloodstream. Said study author Dr. Brian Gordon, "This is something that would be easy to incorporate into a screening test in a neurology clinic. We validated it in people with Alzheimer's disease because we know their brains undergo lots of neurodegeneration, but this marker isn't specific for Alzheimer's. High levels could be a sign of many different neurological diseases and injuries." Finally, a current peer exchange on ajmc.com addresses the challenge of medication adherence for patients with breast cancer being treated with CDK4/6 inhibitors. Dr. Sarah Tolaney, appearing with Lindsay Shaw, says that if physicians don't ask about adherence, they might not know there's a problem.
Adherence is such a challenge because I think many of us don't even realize that all our patients aren't really taking all the medications we prescribe. We saw even when we would just give hormonal therapy by itself, about 25% of patients aren't even taking their medications. So it's striking, and I think you're never going to know unless you ask. And so I think Lindsay and I have made it a point with all our visits to not only ask what side effects are they experiencing, but are they actually taking their drug, and how many times did they miss taking their drug, and why did they miss taking their drug? Was it, sometimes it's because of a side effect that they really just can't bear the thought of taking a drug that's causing them side effects. Sometimes it's financial reasons. Sometimes the copayment's just too high and they didn't pick up their last prescription. But again, you're not going to know unless you don't ask.
For our peer exchange series, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Laura Jost. Thanks for joining us.